Texas is a unique state, very conservative politically, and you know, a lot of what happened with the Affordable Care Act allowed some choices, you know, for states to decide whether they're going to expand Medicaid, various kind of provisions. I'm curious if there's anything in particular, given that you practice in Texas, obviously a state also which has a large immigrant population and such, but anything in particular that affects the practice or the delivery of healthcare that jumps out at you, you know, in the state that you work in?
Locally, you know, we do have a large immigrant Hispanic population, but our economy here I'm in Amarillo, which is in the North Texas Panhandle. It's actually a fairly good economy. So there's a lot of farming and ranching and beef production, a lot of industry. So there is I think a pretty good labor workforce that gets plugged in pretty well, and they have insurance that seems to get them by. And remember, I'm a cardiologist, so probably 60 to 65% of what I see on a daily basis comes through the Medicare market, you know, and the retirees, and that's where heart disease and atherosclerotic disease tends to cluster. But there are folks that, you know, have an episode of chest pain, wind up in the ER, have to go see a cardiologist for a stress test to get released back to work, whatever that job may be. And, you know, some don't have insurance, some do. Our practice tries to make things achievable for patients without any kind of coverage at all. We offer the Medicare rate and discount for cash and things like that. But, you know, we have a certain cost that we need to cover as a private practice and a small business, basically, is what it is. But at the same time, we try to be compassionate about caring for the people that need care at the same time. So maybe the second half of that question is in the local physician organization structure. We do have an ACO that we are part of too. It's an accountable care organization, which with Medicare is kind of viewed favorably as one of the new macro components, and we can talk about that in a little while. But yeah, the ACO works toward streamlining global care plans and taking care of the larger diagnostic realms in Medicare, you know, coronary disease, atrial fibrillation, heart failure, along my lines. And then, of course, in the general medical realm, you know, pneumonia, community-acquired pneumonia, screening for cancers and stuff along more general medical routes. And then finally, what's unique to Texas and some other states, but Texas first and foremost, I think, is tort reform. So the physicians that there's in the 90s, I'd say late 90s, a big influx of physicians to Texas with tort reform, which Pennsylvania had a real hard time with. I left Pennsylvania before anything really happened there, but when I was there, you know, orthopedic surgery, neurosurgery, and obstetric and gynecology practices were really hit hard by malpractice premiums, and just couldn't keep the lights on to see patients because that was sapping their ability to practice. So
just had some reform to presumably make that regulated and more affordable for providers, saw an influx of providers.
Yeah, so I think in global picture, looking at Texas, you know, just generically any community, when you think about healthcare, you know, a good industry, a good economy for the patients to have insurance, or if not insurance, to have, you know, liquid cash to pay for procedures if they choose not to have insurance. And then, you know, an organized medical community, a savvy organized medical community, and then finally, you know, a physician-friendly environment. So